Welcome to our newest episode of the Lebanese Physicians Podcast. And today we will be discussing mental health in children in Lebanon after the August 4th Beirut explosion. And we have two special guests today, Dr. Lilian Ghandour, who is Associate Professor of Epidemiology at the American University of Beirut and has been involved in multiple trials and research involving child mental health in Lebanon, particularly. And we've got Dr. Fadi Maalouf, who is the chairman of the psychiatry department at the American University of Beirut Medical Center, associate professor of psychiatry there, and a prominent child psychiatrist in Lebanon and the region. And today, particularly, we will be discussing a recent trial that they just published in the Journal of Affective Disorders, Anxiety, Depression, and PTSD in Children and Adolescents following the Beirut port explosion. Welcome, Lilian, and welcome, Fadi.
Thank you, Khalid.
Thank you, Khalid. It's a pleasure to be with you today.
Yeah, it's a pleasure to be with you too, and to see you again, both of you. So I'm going to start first with describing that the magnitude of that day, the magnitude of the day when the Beirut explosion happened. Maybe Dr. Ghandour, you can maybe start first discussing that.
Sure. So on August the 4th, 2020, Lebanon and the world actually experienced one of the largest non-nuclear explosions in history. That's what it has been described as over the media. That's exactly how we felt it was, leaving a lot of casualties, injuries, and people displaced from their homes. And even those that weren't actually in the country or in Beirut at the time were negatively affected by this catastrophe. So the magnitude was actually felt beyond the territories of Lebanon and the region.
Right. And I think we were all there at the time and witnessed that big day. So what areas, because Beirut is, it's not a very big city, but there were certain areas of Beirut that were affected more than others. So what areas of Beirut were affected the most by that explosion? And was it close to AUBMC, Dr. Maalouf?
So the explosion took place around the port area, and the districts of Beirut that are closest to the port were most affected. At AUBMC, we saw shattered glass. We definitely felt the huge impact. But most importantly, unfortunately, around 200 citizens lost their life due to the blast, and more than 6,000 individuals got injured. And around 300,000 people were left homeless after the blast. So it was a disaster and a catastrophe for the people of Beirut in that sense.
Right. And I think, I don't know if you both agree with me, we can say probably that areas of high and low socioeconomic statuses were affected equally by this blast because it affected both these areas at the time.
Although we can talk more later on about the fact that actually the most disadvantaged were the most affected. But I agree with you, and the data does show that everyone was affected. Those that were disadvantaged, but also the people that perceived themselves to be more affluent socioeconomically. So everyone was affected, but definitely the poor and the disadvantaged were more and more affected.
And I'm sure, Dr. Maalouf, you started seeing patients after the blast with, especially kids probably with psychological problems related to the blast. So how did the idea of the study come about, and how did you decide to proceed with looking at the questionnaires and looking at the data for this study?
So maybe I'll tell you about the background for this study, and Dr. Ghandour can share with you our findings and data. So definitely, shortly after the blast, we were inundated by phone calls from people who needed help, psychological help, psychiatric help, whether adults or children. As a department, we had several initiatives in that regard. One of them was to develop a trauma assessment and treatment service for free for the people who were impacted by the blast. The initiative was called TASC, T-A-S-C, which stands for Trauma Assessment and Support Clinic. So this clinic was staffed by members of the department on a volunteering basis, whether trainees or faculty or staff. So this is on the clinical front. As we started seeing people clinically, we wanted to also understand what the numbers are and how people were impacted and what's the profile of the individuals who were impacted. Hence the idea of this research study, which was a collaboration between the Faculty of Medicine and the Faculty of Health Sciences, represented here by Dr. Lilian Ghandour, who's a long-term collaborator. Dr. Ghandour and our department, and specifically myself, have been collaborating for more than a decade now, looking at the burden and the prevalence of mental disorders in Lebanon in children and adolescents. So, we got together and we decided to conduct the study to better understand the numbers and better estimate the need down the road and plan for service delivery. Today we're focusing on the child study, but there was also an adult study that was conducted in parallel. For the child study, it was more of a what we call cross-sectional study, and it was an online interview or questionnaires, several questionnaires that were filled by parents of children who were impacted by or exposed, to the blast. And by exposed here, we kept the definition a little wide, so you could have been directly exposed or indirectly exposed by hearing about it from other people or seeing it on the screens. Maybe Dr. Ghandour can share with us more about the actual questionnaires that were used and what the data showed.
Right, Dr. Ghandour. So I saw that you used questionnaires for anxiety, questionnaires for PTSD, and for depression. So how did you come up with the choice of questionnaires that were used? And then what children were targeted? Like which areas were targeted? Was it only the areas close to Beirut, or was it also areas that were outside Beirut too?
Okay, thank you, Khalil. And I want to stress on the idea and the importance of having a collaborative sense of a collaborative team already set up, because that's what made it possible to actually immediately put together this study and be able to make that assessment within 3 to 4 months immediately after the blast. And the reason it took this much time was not to put together the team, but to put together the study, the methodology, and to obviously get IRB approval, because we needed the Institutional Review Board's approval, which took some time. But the fact that we had this team already working together for so many years actually really speeded up the process of documenting assessment and documentation. In terms of the choice of the questionnaires, that's a very good question from an epidemiological point of view. And again, we were lucky that we had access to Arabic validated instruments. What we mean by that is that often, there are tools that are ready for use, but that have not been contextualized or maybe assessed for validity within the context of an Arabic-speaking population or within the context of Lebanon per se. So what we ended up obviously choosing are the tools that have been validated in the Arabic language and that have been used by our team and others in other epidemiological surveys. So we used the SCARED tool, which is which helps you. So just to make it clear that all of these tools are screening tools. So they don't come up with definitive diagnoses as a clinician would, but they would help you basically tell what percentage of the population would have a probable diagnosis of depression, a probable diagnosis of PTSD, and a probable diagnosis of anxiety. So for depression, we use the Mood and Feelings Questionnaire, which is the MFQ questionnaire, which is, like I mentioned before, is Arabic validated and has been used by our team before. We used for the anxiety symptoms, to screen for anxiety symptoms, the SCARED questionnaire. And for PTSD, we used the CRISE 13. I'll be sharing with you the findings in a bit. But again, these are tools that would allow you to screen for probable diagnoses and identify the at-risk children and adolescents in the population.
And all these tools are validated in the Arabic language too.
Yes, and have been used by our team before and have been used by other researchers in the region as well. Yes.
Right. And so when you started targeting or talking to families using these tools, which areas were most targeted? Were there more areas that were more targeted than others too?
Okay. So yes, you had mentioned that. So we targeted, so what we did was, this was an online survey. So technically, as you can imagine, Lebanon at the time was experiencing multiple crises. We were also experiencing in parallel the financial crisis, but also the COVID pandemic. So the country was on lockdown on and off. So we had to basically use the online methodology to try to reach as many participants as possible. What we did is we circulated the link on various social media platforms, institutional and personal, and multiple different social media platforms, including Facebook, Instagram, Twitter accounts, and also WhatsApp messages on groups, etc. So what we try to do is also try to diversify the population that we are reaching, by also making sure that the tool is available in Arabic and in English, so that the participant, the parent, when filling the questionnaire, may choose to either fill it in English or in Arabic based on the language of their own preference and ease of use. And we targeted parents of children who had children between 8 to 17. And each parent could have filled the questionnaire on more than one child. So if, for example, a parent had 3 children between the age of 8 and 17 and wished to fill the questionnaire for all three children, the questionnaire allowed for that. So that's a good thing, so that we didn't have to, because we went back and forth, if you remember, Dr. Maalouf, about the choice of which child to choose, whether if we chose randomly, what if we left out the child that had, for example, the most mental health distress. So, and in terms of the districts, because you mentioned the districts, we did not target specific districts. We actually made it, we opened it to all of Lebanon. So, to all of Lebanon. And so basically, but then we ended up categorizing the districts as such. So for example, District 1 was the district that was the nearest to the port. So it included, for example, areas such as the port, Ghandour, Ermel, and Saifi. And then we had District 2, for example, that was more like Min al-Husns, Al-Blad, Beshura. And so District 3 was further apart, farthest from the explosion site. And then obviously those who were not in Beirut at the time were a separate category.
Right. And so you did the questionnaires, and then you what was the data that you got? What were I was surprised. I mean, the rates were pretty high. Rates of anxiety, yes, PTSD, and depression were pretty high in the studies. So can you tell us about what the rates were, and also if there's data on what the rates were by district or by how far away the individuals were from the explosion site?
So the rates were, quite shockingly high. But again, this is a screening tool, but that doesn't mean, that this, not a substantial proportion were actually experiencing mental health distress. But just to give you an example, a third were screened with a probable depression. A third of the children and adolescents aged between 8 to 17 were screened with probable depression. About half were screened with probable PTSD, and a higher percentage was around 2/3 were screened with anxiety. according to the SCARED validated tool. Now, in terms of these percentages, let's just say the further you were away, the lower the percentages were. That doesn't mean that those who were farthest away did not experience, because the numbers were still high for those who were further away, and even not in Beirut, which again reflects the fact that the impact transcended a physical territory. So even those who were not physically there were mentally affected, but clearly those who were closest to the port were the most affected.
Okay. And one more question. So the ones closest to the port, or even the ones further away, was there a difference in rates based on socioeconomic status of the families at the time?
Yes. So in a way, the areas closest to the port are also kind of the areas that were most disadvantaged and the poorest. So we also found the same linear trend. So the way we measured socioeconomic status, because I'm sure you know that it's a very difficult indicator to capture accurately. So what we're normally asking these days is asking people to self-report how they perceive themselves compared to others in their community, whether they perceive themselves to be a lot poorer, a little poorer, about the same as most, a little richer, or a lot richer. So this is basically a self-perception. And we feel that, and the research has shown that this is quite a good indicator when we're trying to capture socioeconomic status or self-perceived socioeconomic status in one or two questions. Otherwise, we would have to administer a scale and an index to be able to do it more accurately. And so again, what we found is that people who self-perceive themselves to be among the poorest compared to the richer population are the ones that were most affected. So the estimates were actually higher among the disadvantaged poor.
Yes. And do you think, one question I had actually is, do you think that the COVID pandemic and the financial crisis had contributory roles with this? Like, were the rates also high because of other factors, not just the explosion itself?
Dr. Maalouf, would you like to?
Maybe.
You're muted.
It's hard to say. I can tell you clinically what we're seeing, but in terms of research, I don't think we've conducted the study. We've designed it in a way to be able to tease out the impact of the COVID pandemic, the blast, and all of these stressors, unfortunately, did overlap or happen at the same time. So I think from a research perspective, it would be very difficult to design a study and look at the isolated effect of the blast versus the cumulative effect of all the other stressors. But I can tell you clinically, definitely it depends, I think, on the person, or the individual. Some individuals that we're seeing in the clinic, some children that we're seeing in the clinic appear to be more impacted by the pandemic per se. So they either lost someone due to COVID. I have children who lost their parents to COVID, or their grandparents, and now they're struggling with either grief or illness, anxiety. Some people were impacted by losing friends to immigration due to the economic crisis. So this is, whatever social support or peer support they used to have at school, now they're finding themselves without their close friends or close social circle. And this is also causing additional mental health problems. And we're seeing also people impacted by the blast presenting late. So I've had kids who presented a year or 14 months after the blast, either because their parents were not sure that this is the mental health impact of the blast, or because they were triggered by the first anniversary in August 2021.
Right.
Khalil, if I may, as an epidemiologist, I would just want to stress the point that was made by Dr. Maalouf, that ideally we would want to address or try to investigate the impact of these different stressors, because like I said, Lebanon is undergoing multiple crises. We were even called quadruple crisis. We've had multiple different crises happen in parallel. And as an epidemiologist, one would want to maybe try to isolate the impact, but the truth is it's very difficult. It's very difficult. And so it all matriculates at the end of the day to, for example, job loss, or loss of financial security, or, so these are the sort of the main sort of proximal indicators that are ultimately impacting one's mental health and one's livelihood. But again, at the end of the day, what really matters is the impact of all of these, right? So instead of spending time trying to understand, how, the synergistic effects of all these, at the end of the day, what we will talk about this, a little further down the line, but, sort of what is needed to make sure that they have the right response system, and knowing that, regardless of how it happened, right now we have a substantial proportion of, children and adolescents that need help, that require care, and that need, a source of support for management of their symptoms.
Right. And I agree. I think we could have missed even some of the, a lot of the kids were impacted, but to different levels, I guess, because I can give my experience. For example, my older daughter, when we visit Beirut now, because she was there when this happened, she doesn't want to stay in Beirut. She wants to stay up in the mountains. She's always worried there's going to be an explosion.
And my 5-year-old still calls it the tornado and worries about another tornado because the windows flew open at the time of the blast. So in his mind, as a 4-year-old, this was a tornado.
Right. So Dr. Maalouf, do these numbers correlate with what you've been seeing in clinic? That's number one. Number two, do you feel that the numbers hopefully are going down with time now that we're about closer to 2 years out from that event?
So the numbers, when compared to numbers after other global disasters or disasters that happened elsewhere, for example, World Trade Center, 9/11 or other disasters, are quite elevated. The number of anxiety disorders is quite shocking. So 2/3 of kids who were exposed did screen positive for an anxiety disorder. And this is definitely what we're seeing in clinic. I'm seeing a lot of kids presenting with different kinds of anxiety disorders. We've seen a lot of school refusals at the beginning of the school year. Kids who are worried to go to school because of, there is the issue of the pandemic, but some kids are also worried about their parents and about their own safety. Something bad would happen when they're at school, or something bad would happen to their parents when they're at school. So they're developing this, nausea, headaches every morning or the night before, and they're not able to go because of overwhelming anxiety. So we're seeing that. We're seeing a lot of kids with different somatic complaints. They undergo, investigations with their pediatricians, gastroscopies, endoscopies, etc., and nothing is there, and turns out it's anxiety. We're seeing a lot of recurrent panic attacks and anxiety attacks. So definitely on the anxiety part, our clinics are full with kids with, unfortunately, anxiety disorders. The PTSD, we're not seeing much of it. So it's either they did not present for care or for treatment, or that the numbers have been going down since the blast. I would say the anxiety numbers, the number of anxiety disorders is constant, still elevated, but probably the numbers for PTSD and depression, clinically at least, my impression, may be going down. But it would be ideal to do a follow-up study. I think Dr. Ghandour would like that, a follow-up study on the same sample or a similar sample, and see what's happening to these numbers.
All right, Dr. Ghandour, you've got some work to do.
Yep. Khalil, if I may add, actually, the percentage of people who reported seeking mental health treatment. So we also asked them about whether they sought any mental health treatment after the blast, and 2/3 didn't, actually. So only 1/3 reported seeking mental health support. We asked them whether the support was actually a professional or a non-professional. So again, and what we found is that those who had those who did seek mental health treatment are those who had experienced or who had a higher likelihood of being screened for depression, PTSD, and anxiety. And so again, it seemed to us that our conclusions were basically that maybe, most likely, actually, not maybe, these individuals were seeking treatment on an individual basis. And what we hope for in the future is to have sort of a more blanket intervention to make sure that everyone, regardless of risk of developing mental health problems, receives some kind of mental health support, because everyone needs it, and not necessarily only those who are screened for probable depression, anxiety, and PTSD.
Right. And on that note, so what are some of the services that are available for kids in Lebanon right now? Because I think obviously probably financial constraints may be a factor in preventing people from seeking help, but are there services available for, let's say, very little money or free to help these kids out?
So, Khalil, you're familiar with our OPD system here. Right. So as part of our services, we do have the private services, but we also have subsidized services that are part of what we call OPD, which is outpatient department. So we do offer psychotherapy treatment and psychiatric treatment. Under psychotherapy, there are different types of psychotherapies that our therapists do offer to children and their families, ranging from what we call trauma-focused CBT, which is the most evidence-based psychotherapeutic interventions for kids with PTSD or post-traumatic events, and what is known also as narrative exposure therapy, which is typically conducted with younger kids, and also focusing on addressing the issue of the trauma. There is also, psychiatric interventions. Some kids may need medications, but most of them do not. And we do family interventions with our case managers. We connect them sometimes with local services. We coordinate with the school to help provide accommodations for kids who have been having difficulty going to school. That being said, I don't think we're the only place that provides subsidized or care for at a subsidized fee. There are other NGOs also in Beirut. Some of them are focused on mental health or healthcare in general that provide also services either free of charge or at a subsidized rate.
But basically, most of the services that are available, the families and the kids probably seek the service, and not the other way around, where NGOs go into the community and assess for the need for services, right? So it's mostly sought out by the families of the kids. Am I correct?
So this is very important, and it's a distinct difference between what we observed here and what was done elsewhere. So as Dr. Ghandour mentioned, in our study, we showed that kids who did seek help are the ones or the kids who received help were at higher risk to develop PTSD, anxiety, and depression. If you look at the data from the 9/11, for example, disaster, you see also, it's the other way around. So people who received help were at lower risk to develop mental health problems. Why is that? Because the intervention over there was done in a preventive manner. So everybody did receive an intervention. And so if you were at a risk to develop a disorder, the intervention helped mitigate that risk. So because you received the intervention, now you're at a lower risk to develop a disorder. In our part of the world, unfortunately, that wasn't the case. As you said, I don't think efforts were properly deployed to offer these preventive interventions to the population who was exposed. People individually sought help because they were in distress or because they had symptoms. So whoever got help, it was because they were suffering, unfortunately. So I think this is an important distinction.
Right.
From public health.
Right. And I think we mentioned the kids, but I think we also need to mention the parents too, because probably the parents were as affected as the kids. And I think this is evident in the other parallel study that was published on the same topic, right?
Yes. So it would have been ideal to link the parents to the children in the same study, but that would have created a research burden on the families. So we ended up doing a parallel study on adults that showed pretty much very high negative mental health impact on the parents as well, on the adults as well. I just wanted to add one thing, that as you were talking about the mental health response and services, we had what we ended up doing as extra analysis was also looking at whether socioeconomic status, self-reported socioeconomic status, would still stand out after controlling for all the blast-related factors. Because as I had mentioned, proximity played a role, losing or experiencing major damages to the home played a role, experiencing injury or death in the family played a role. And also, so what we did was we did a further analysis that actually controlled for all of these blast-related factors, in addition to the socio-demographic characteristics, and still SES came out as an independent predictor of mental health, which, this could be a whole other podcast on its own, trying to understand the mechanisms linking SES to mental health. But what it means on the short run, and from a mental health response perspective, is that any mental health response should give an immediate and greater attention, most likely to those most disadvantaged financially, because these are the ones that were actually most negatively affected by the blast or by the explosion, even after controlling for where they live, what they have experienced, what they have witnessed, and their various socio-demographic characteristics. So I felt that it was important to shed light on this, that really the people that are most in need were the most affected, and that's why we need to be dispatching a faster response system for this group.
For this group of people, right. And so with this discussion, what do you think are the long-term effects of this on the kids' mental health when they grow to become adults, Dr. Maalouf?
So luckily, we do have a resilient brain, and showing symptoms, especially not as a part of a diagnosis, but showing clinically significant symptoms, which our study did look into, does not necessarily mean that you're going to live with a psychiatric disorder for the rest of your life. So I'm hoping that most of these kids would outgrow whatever clinical symptoms they had after the blast. But there are certain things that would help predict a better prognosis. So receiving intervention, I think, is key. So if kids are suffering and do exhibit certain symptoms, the more chronic these symptoms become, the more likely they are to last later on in life. So that's why my message to families and parents, if you're seeing, if your child is complaining, or if you are noticing that your child is manifesting behavioral or emotional difficulties, it's important to seek help, because early intervention is key to predict long-term outcomes. Now, in addition to early intervention, I think severity of symptoms is another predictor. So if you're having low mood and not sleeping well, and you screened high on depression as a result, is one thing. But if you're having suicidal ideations as part of your depression symptoms, definitely then your symptoms are more severe, and you may be at a higher rate for recurrence down the road as an adult. So severity of symptoms, not receiving care, proper care, I think are the two most important predictors of how these kids are gonna fare in the long run.
And if I may add, Khalil, I mean, we are living in a context, whether regionally or locally, of, this is not, surprising that Lebanon would experience, unfortunately, a traumatic event as such. I mean, in magnitude, it was much bigger than we had ever maybe experienced. But in reality, we are living in a context with political instability, insecurity, and given the history of Lebanon, I think there is a need, in addition to all these services that Dr. Maalouf has spoken about, there needs to be a proactive emergency mental health response. Because right now, the children that have been, fortunately, they don't need that. This doesn't mean that those who have been exposed are necessarily going to develop disorders, but that puts them at a higher risk of developing disorders now that they have been exposed to such a huge traumatic event. And so if they are disadvantaged, they are at a higher risk. If they have been exposed, that they are now, imagine those who are disadvantaged financially and have been exposed to such a traumatic event. These are what we call in public health at the high risk populations. And so these high risk populations, in the event of experiencing any kind of additional traumatic event, are at a high risk of developing a disorder. And so for this reason, we can't sit on the side and wait for another catastrophe to happen to start talking again about the importance of documentation of this data and informing a sort of an emergency mental health response. We do have at the national level a national mental health strategy, and I believe that under that umbrella, there needs to be a concerted, coordinated effort, including clinicians, public health professionals, academicians, epidemiologists, etc., to try to make sure that there is an emergency mental health response for children and adolescents and their parents and adults in the event of such, or maybe hopefully a smaller magnitude event happens, to make sure that we have the right response and right response for these individuals.
Yeah, thanks to both of you for conducting the study. I mean, it's eye-opening just to see the numbers of kids who are affected by what's happening or what has happened in Lebanon, especially the blast. And hopefully it will stimulate a discussion on a better emergency mental health response to be proactive in case something else happens. And hopefully nothing will happen like this in the future in Lebanon. Thank you very much.
Thank you,
Khalil,
for highlighting the study and the findings, and for doing this podcast. It's although we are in Lebanon, I'm a close follower of your podcast. Enjoy.
Thanks. Thank you.